A 28-year-old woman comes to the clinic with complaints of pelvic pain and heavy menstrual bleeding for the past 6 months. She reports that the pain is most severe during menstruation but sometimes occurs throughout the month. Her periods have become progressively heavier, requiring her to change pads more frequently. She has no significant past medical history and is not currently using any contraception. On physical examination, the uterus is uniformly enlarged and mildly tender. Pelvic ultrasound reveals a diffusely enlarged uterus with a thickened myometrium and small, scattered hypoechoic areas. Which of the following is the most likely diagnosis? A. Endometriosis. B. Uterine fibroids. C. Adenomyosis. D. Endometrial hyperplasia. E. Polycystic ovary syndrome, PCOS. Please pause and write your answer in comments. Now let's find the correct answer. Explanation. The most likely diagnosis is C. Adenomyosis. Adenomyosis occurs when endometrial tissue infiltrates the myometrium, muscle layer of the uterus, leading to a diffusely enlarged and tender uterus. The condition typically presents in women in their 30s and 40s with symptoms of heavy menstrual bleeding, menorrhagia, and pelvic pain, particularly during menstruation, dysmenorrhea. On ultrasound, the uterus often appears enlarged with a thickened myometrium and may have small, scattered hypoechoic areas, which are suggestive of adenomyosis. Why not the other options? A. Endometriosis. Although endometriosis also presents with pelvic pain, it is typically associated with infertility and normal uterine size on physical examination. The uterus is not uniformly enlarged in endometriosis, unlike in adenomyosis. B. Uterine fibroids. Fibroids, leiomyomas, can cause heavy menstrual bleeding and pelvic pain, but they usually result in an irregularly enlarged uterus, with distinct, palpable masses on examination rather than a uniform enlargement. D. Endometrial hyperplasia. This condition can cause abnormal uterine bleeding, but it is more often associated with postmenopausal bleeding. It does not typically present with an enlarged or tender uterus. E. Polycystic ovary syndrome. PCOS is associated with irregular menstrual cycles, hirsutism, and infertility but is less likely to cause heavy menstrual bleeding or an enlarged uterus. Key takeaway. Adenomyosis typically presents in women over 30 with a uniformly enlarged, tender uterus, heavy menstrual bleeding, and dysmenorrhea. It can be distinguished from conditions like fibroids and endometriosis by the diffuse nature of the uterine enlargement. If you loved this video, please like and hit the subscribe button. We will keep uploading new questions on a regular basis.